My name is Joe Charlemagne, and I am chair of the Surgical Technology program at Berkeley College. What motivated me to get involved with Healing the Children New Jersey is the compassion and care that they provide globally to children in need. I myself always wanted to participate in the medical mission from when I first heard of it, but financially at the time of my life, I couldn't afford it. Once, probably about 5 years down the road, afterwards, I was able to afford to go on my first medical mission. And from there, that was it. You know, I wanted to go every year, and then sometimes 2 times a year I would go on medical missions. Being involved in the medical mission work is just a very fulfilling experience. Coming from a hard background, you see that those in need help. And to be able to make a difference in the world, one child at a time, that's what those medical missions are offering you. Our first day at the clinic, there was about 350 patients waiting for us when we were coming off the bus, and it was just, shocking and awe-inspiring to see that many people who had been waiting and had traveled from all parts of the country just to this one local hospital. The patients that you treat on these missions are so grateful and so thankful, and they have done so much to get to this point. Berkeley College became involved with Healing the Children of New Jersey because as program director for the Surgical Technology program here at Berkeley College, I began to see that when Healing the Children needed help sterilizing instrumentation, packing medical supplies, that there was also a learning value there that could be incorporated in the students' curriculum. We're like a mobile hospital, documenting paperwork, administrative services. This is an entire surgical team with an administrator, with a pre-op, post-op surgical team, and depending on how many interventions you're planning on doing, the cost of these missions is something that is an investment that is going to pay off triple, quadruple about the impact that it makes on these children's lives. You're changing lives.
I'm Michael Smith, president of Berkeley College. Berkeley College is involved with Healing the Children and these medical missions for a multitude of reasons. From a very basic perspective, it provides real-world practical experience for our students. And they understand that what they're doing has meaning. And then there's the aspect of just being a global citizen, taking our teaching professionals and taking them out of the classroom and sending them over, learning and teaching and actually providing care for these children that are changing their lives. It's an incredible, incredible thought. This is what you do when you consider yourself as part of the world. We start, and then the faculty comes back and they talk to the students and they explain what's going on, and they talk about how their work and their role played an impact on saving perhaps as many as 100 or 200 children's lives. When students and faculty go in to see how others live, you can read about it, you can hear about it, you can even watch very impactful video about it. But when you're there, there's a third dimension that makes all the difference in the world. It's life-changing for our students, it's life-changing for our faculty, and Healing the Children is doing extraordinary work, and Berkeley College is so proud to be partners with them, and we invite everyone to join us.
My name is Jim Moffitt. I'm a CRNA. My first trip was to Santo Domingo. It was an orthopedic trip with Dr. Doug Avella and Ed Neuenhaus. It was humbling, it was mind-boggling, it was scary. There were times when we would lose electricity. And I remember one trip being in a tiny little closet that we turned into an operating room with a desk from an office and an air mattress. And halfway through a procedure, the electricity went out. And we all put on Cabela headlights and continued with the surgery. No one missed a beat. And then I knew I was with a special group of people that adapted so well. Back home, that would have been a big issue. When we arrive, the trips are so well packed. We have all our resources, we have all our drugs, we have all our equipment. We have portable anesthesia machines that are wonderful. Healing the Children takes care of all of that. The resources are there when we get there, if they allow everything to get through customs okay, which on occasion has been difficult. But we make do with what we have. You adapt and you fall back on your clinical skills to make things happen. And that's what we're there to do, make things happen. At some point, you realize that you don't have much of a choice. You're here to help these children and you have to do what it takes to get done. It's almost impossible to stress the importance of what we do for these children. What they need and what we provide is overwhelming. The sense of gratitude, just the perspective it gives you on your own life. Whenever I go on these trips and I come home, I have a whole totally different outlook on my life. Things that I thought were important aren't. You know, I'm concerned that I didn't have a heated steering wheel in my new car. And then I think back on these children that come to the clinic without shoes. And it's, excuse me, it's emotional. You know, it really is. We need new people. We need young people to be encouraged to go on these trips and to help out, because some of us old guys are slowly starting to fade out. As long as I have my clinical skills, I'll continue to do this. But we need to encourage the new people. Don't be afraid, because everyone that goes on these trips will get you through it. So just do it. Be that person that doesn't just say, oh, I always wanted to do a trip. Be that person that does a trip.
My name is Ralph Caprio. I'm a medical doctor. I am the managing partner of the pediatric group that we're talking about today, which is Notch View Pediatrics, and I am happy to be partnering with Healing the Children. One of the interesting things about dealing with Healing the Children is that you're always going to learn something by these people coming to see us. And at times I sort of trivialize what I do because there's so many more important people that are doing wonderful things, like are actually doing the surgeries, that are correcting things that have to be corrected. But I guess I do play a role because it's seemingly very much appreciated, and but it's just sort of like practice as normal for me on a regular basis. And so some of the things that we're seeing are things that possibly pediatricians would never even see. Some of these are really learning experiences for us. So there's follow-up, there's continuity, and so it makes for a very, very happy meeting for us. No different than the kids I take care of every day. Some of their problems have much greater magnitude, but in fact they need the same type of comprehensive care that I try to deliver with all of my patients. I guess I'm a critical link in providing the path for these kids to be cared for. And so even though my approach is the same to every patient, be comprehensive, do what I have to do, be very focused on the issues at hand, all right, for the most part, I guess the role that we play as pediatricians, or just in general primary care people, is vital. And if you ever saw some of the kids that come from these countries, and I mean they are somewhat disfigured, the quality of their life is incredibly poor, not only from a medical standpoint, but from a psychosocial standpoint, and this changes everything in their life. To be able to do something for these kids that would generally not be able to have access to that type of care is absolutely wonderful. I mean, I feel like standing up and applauding. The satisfaction that I get from seeing that reward, all right, is absolutely wonderful. I mean, and it definitely is worth it. I mean, it absolutely is worth it. It's not really work in my mind. We just do it.